Welcome to Lesson 9. In this lesson, we will study ICD-10-CM Chapter 5, which covers mental, behavioral, and neurodevelopmental disorders, coded from F01 through F99. This chapter is very important for the CPC exam because coding depends heavily on provider documentation, severity, and specific guideline rules. Lesson objectives. By the end of this lesson, you will understand pain disorders related to psychological factors, mental and behavioral disorders due to psychoactive substances, use, abuse, and dependence hierarchy, substance use in remission, factitious disorders, dementia coding and severity rules. Important Chapter 5 rule. Before we start, remember this rule: never assume mental health conditions. All Chapter 5 codes must be based on clear provider documentation. Severity, remission, and psychological involvement must be explicitly stated. Pain disorders overview. Pain disorders may be caused entirely by psychological factors or by physical pain with psychological involvement. Correct coding depends on which scenario is documented. F45.41. Pain exclusively psychological. Code F45.41 is used when pain is exclusively related to psychological factors. This means no physical cause is documented. Pain exists only because of a psychological disorder. In this situation, do not code any pain code from category G89. Excludes one rule. Very important. There is an excludes one note between F45.41 and G89, pain, not elsewhere classified. An excludes one note means these codes can never be reported together. This is a very common CPC exam trap. F45.42. Pain with psychological factors. Code F45.42 is used when the patient has acute or chronic physical pain, and psychological factors contribute to that pain. In this case, checkmark assign F45.42 checkmark and assign a G89 pain code. Pain coding summary. Let's summarize pain coding. If pain is only psychological, right pointing arrow F45.41 only. If pain is physical with psychological factors, right pointing arrow F45.42 plus G89. If pain is only physical, right pointing arrow G89 only. Substance-related disorders, F10, F19, categories F10 through F19 include disorders related to alcohol, opioids, cannabis, sedatives, cocaine, other psychoactive substances. Substance use, in remission. Codes that indicate in remission include codes with .11, .21, or .91. These codes are assigned only when the provider documents remission. You must never assume remission. Remission severity rule. Here is a very important rule. Mild substance disorder in remission, right pointing arrow code abuse in remission. Moderate or severe disorder in remission, right pointing arrow code dependence in remission. Severity must be documented by the provider. Use, abuse and dependence. Sometimes the provider documents use, abuse, dependence. For the same substance, only one code should be assigned. Coding hierarchy, exam favorite. Always follow this hierarchy. Keycap 1 dependence, keycap 2 abuse, keycap 3 use. Code the highest level documented. Hierarchy examples. Let's see examples. If use and abuse are documented, right pointing arrow code abuse only. If abuse and dependence are documented, right pointing arrow code dependence only. If use, abuse, and dependence are documented, right pointing arrow code dependence only. Never assign multiple codes for the same substance. Unspecified substance use codes. Codes like F10.9 through F19.9 represent unspecified substance use. These codes must be provider documented, must meet the definition of a reportable diagnosis. When unspecified codes are allowed. Unspecified substance use codes are allowed only when substance use is linked to a mental disorder, behavioral disorder, or medical condition. The relationship must be clearly documented. Medical conditions due to substance use. Medical conditions caused by substance use are not classified as substance-induced mental disorders. You must code the medical condition and code the substance use, abuse, or dependence. Example: alcoholic pancreatitis. For alcoholic pancreatitis, assign K85.2 for alcohol-induced pancreatitis. Assign F10.20 for alcohol dependence. Do not assign F10.288. Blood alcohol level, Y90. Codes from category Y90 may be assigned when blood alcohol level is documented and an alcohol-related disorder, F10, is present. The test does not have to be ordered by the provider. Factitious disorder overview. Factitious disorder occurs when a person falsely reports illness or intentionally causes symptoms. The goal is to assume the sick role, not financial gain. Factitious disorder imposed on self, also called Munchausen syndrome. Code F68.1. This code is assigned to the patient who causes their own symptoms. Factitious disorder imposed on another, also called Munchausen syndrome by proxy. Code F68A. This code is assigned to the perpetrator, not the victim. Coding the victim. The victim is coded using T74 confirmed abuse, T76 suspected abuse, based on provider documentation. Dementia overview. Dementia is coded in categories: F01 vascular dementia, F02 dementia in other diseases, F03 unspecified dementia. Dementia is classified by cause and severity. Dementia severity levels. Severity levels include unspecified, mild, moderate, severe. Severity must be documented by the provider. Dementia without severity. If severity is not documented, right arrow assign unspecified severity. Never assume severity based on symptoms alone. Inpatient dementia progression. If a patient is admitted with dementia and it progresses during the stay, assign only one dementia code, code the highest severity level documented. Common CPC exam mistakes. Avoid these errors. Coding G89 with F45.41. Assuming remission. Coding multiple substance levels. Assigning F68A to the victim. Guessing dementia severity. Lesson summary. In Lesson 9, we covered psychological pain disorders, substance use hierarchy and remission, medical conditions due to substance use, factitious disorder coding, dementia severity rules,